House File 5 is a proposal to provide paid family medical leave to Minnesota employers to provide that benefit to their employees. Now, with paid family medical leave, we've been talking about this for several years, and the state of Minnesota, the legislature decided in its wisdom to study the issue, and the University of Minnesota produced a study on how we could actually bring paid family medical leave to the state of Minnesota. And this bill is a first draft of that process. We have heard similar proposals in the past, and one of the things I wanted to make very clear about this particular discussion that we're beginning today is that this is the beginning of a discussion. There are many stakeholders who have a great deal of interest in this particular bill, and I've been very busy meeting with stakeholders. I continue to be. And so today I did not bring an author's amendment because I'm still gathering input and looking for places where we need to make changes in the bill, but that will be forthcoming in our next committee stop. So just wanted members to have that particular context. Paid family medical leave is an idea whose time has come in Minnesota. Our economic growth depends on greater workforce participation in the state. At the same time, we know as policymakers that the cost of childcare, particularly for infants, is unaffordable for many families and out of reach. And it's a significant barrier for people getting into the workforce. And we have a generation of people who seeing their parents begin to age and want to be there to make sure that they're helping with family health transitions, everything from having to transition into assisted living, to being there for hospice, to caring for a member of the family during their illness. We're looking currently at the demographics of people in Minnesota age 65 or older are starting to overtake the number of school-aged children. So the issue of aging Minnesotans is real. And as policymakers, we're being asked to solve these questions, and we're being asked as a state to put resources toward more affordable childcare and accessible childcare, toward elder care. Minnesotans care about each other, and Minnesota employers are working to do the right thing for their employees. While we're wrestling with these issues, we've got workers who are saying they want to provide this care for their families. They want to be able to be sure that they can be there for a sick loved one, that they can spend the necessary time with a new baby to bond and make sure that that child has the healthiest start in life. And at the same time, they want to work. It's one of the great pieces of our reputation as a state in Minnesota. We are hardworking people in Minnesota. Many Minnesotan employers have recognized the business case for paid family medical leave and the pressure on our workforce in participation and balancing their life moments. And they support their employees in providing the care. It's a very Minnesota way to be, making sure that our hardworking Minnesotans get to participate in the workforce. So we know that Minnesotans people across the country are supportive of paid family medical leave, and we're following the experience of other states who have implemented paid family medical leave. And we know that employers around the state have implemented similar policies in order to retain and grow their own workforces. So it's time to make sure that all Minnesota employers and workers have access to this benefit. In our hearing today, I'll provide a high-level overview of the bill with this caveat: it's going to change. This is the start of a process to get input and to hear from stakeholders to make sure that employers, workers, government entities, and others have a seat at the table while we plan and implement this new policy. I expect an author's amendment on my next stop in the Commerce Committee, so this is the start of a conversation, and I'm glad you're here for it. So in short, the bill provides for 12 weeks of medical leave with partial wage replacement, or 12 weeks or 12 weeks of family leave to bond with a new baby, care for a sick loved one, through an insurance program that's modeled on Minnesota's unemployment insurance. Employers and employees, as the bill is written, contribute to the pool. The intent is that the people who are benefiting from it also get to be part of building the program. The program excuse me. It's not intended to be vacation or other types of leave. There are qualifying events that are spelled out in public policy, and that must be confirmed via a qualified healthcare provider. Like on insurance benefits, the employee is only available to get the benefit if they have been working in the last previous 4 quarters and earned a minimum salary. A premium is collected from employers and employees to pay for the program. We're currently working with DEED to determine the premium amounts needed to establish and maintain the program. Mr. Chair, I understand this isn't a finance committee, so that will be addressed in a future committee. So that's a brief overview of where we're starting. And as I mentioned at the outset, I'm committed to working with stakeholders to increase clarity and address concerns.